Welcome back to the last session of the practical series with Dr. Bhavana Grandhi, Learning Pathology. Here we discuss the peripheral smear abnormalities. Abnormalities of peripheral smear. RBC, the normal parameters, size is 7.2, shape is biconcave. In the peripheral smear, you have to describe it as normocytic, normochromic. Variation in size is called anisocytosis, whereas variation in shape is called as poikilocytosis. What do you mean by normocytic? Normal shape and size is called as normocytic. We compare the RBC with a small lymphocyte, then you call it as normocytic. Coming to the chromic, it describes the hemoglobin content. Usually the central 1/3 is less than 1/3. If the central pallor is more than 1/3, you describe it as hypochromic, usually seen in anemic conditions. Abnormalities of shape, cystocytes, seen in hemolytic anemias, spherocytes, the shape of a sphere, hereditary spherocytosis, elliptocyte, hereditary elliptocytosis, microcytes in iron deficiency anemia and thalassemia, macrocytes, megaloblastic anemia, sickle cells seen in sickle cell anemia. Diagrammatic representation of the same. The first one, normal. Second one is the target cell seen in iron deficiency anemias, spherocyte, ovulocyte, elliptocyte, acanthocyte, and all the other abnormal shapes. When the hemoglobin and the RBC count is reduced, we call it as anemia. Normal RBC count ranges from 4.5 to 5.5 million per cubic millimeter. Anemia is classified depending upon the morphology, microcytic or macrocytic. Etiologically, because of the blood loss, nutritional deficiency and hemolytic anemias, which are discussed well in your theory classes. Coming to the WBC, the normal count 4000 to 11000 per cubic millimeter. Differential count, neutrophils account for the major part of the differential count, 40 to 70%. Lymphocytes come the next, 20 to 40%. Eosinophils 2 to 8%. Monocytes 2 to 6%. Basophils 0.5 to 1%. When the count of the neutrophils is increased, you call it as neutrophilia, seen in acute bacterial infections, acute inflammation like acute appendicitis, and stress. Whereas when the neutrophil count is reduced, you call it as neutropenia, seen in infections like typhoid, paratyphoid, radiation, and drugs like benzene. Next, eosinophilia. Eosinophil count is increased. Allergy, asthma, parasitic infestation like filarial worm and roundworm. When the basophils are increased, you call it as basophilia, seen in CML and urticaria pigmentosa. Last abnormality, when the lymphocytes are increased, you call it as lymphocytosis. Chronic infections like tuberculosis, infectious mononucleosis, and leukemias like CLL. Whereas monocytes are increased in AML M4, AML M5 type of leukemias, and also in infections like Kala-Azar and typhus fever. Here is a question which is very commonly asked. What do you mean by leukemioid reaction? When the WBC count is increased up to 50,000 cubic millimeter, you call it as leukemioid reaction. There is a mild shift to left with myelocytes and band forms. The alkaline phosphatase score, which is called as the NAP score, is increased, but there are no blast cells. It is seen in infectious mononucleosis, measles, chickenpox, and viral fevers. Whereas leukemia, the count will be more than 50,000, sometimes up to lakhs. Blasts are seen. NAP score is normal. We classify the leukemias into myeloid and lymphoid. Both of them again classified into acute and chronic. Lastly, platelets. The normal count is 1.5 to 4 lakhs per cubic millimeter. In the peripheral smear, they are identified as small, violet, refractile bodies. When the platelet count is reduced, it is called as thrombocytopenia. And when it is increased, you call it as thrombocytosis. The causes of thrombocytopenia, ITP, idiopathic thrombocytopenic purpura, classified again into acute and chronic depending upon the duration, DIC, drug-induced thrombocytopenia, and dengue fever. Thrombocytosis is seen in essential thrombocythemia, post-splenectomy, post-hemorrhage. Thank you. Thus we have completed all the practical series. Hope all these videos will help you in the practical examination. All the best. Thank you.